Hello, my name is Joseph Craig Longenecker. I'm the Academic Dean at the Faculty of Public Health, and today I'm going to explain to you what the Bachelor Program in the Health and Community Studies is and what it's about. I think that many people, when they think about, say, being a doctor or a nurse or a dentist or a lab technician, when you tell people that, most people in communities know what we're talking about. They can imagine a lab technician with a tube of blood and a machine and doing that, or the dentist looking at a patient with their mouth wide open and they're looking in their mouth. But when you say, I want to go into public health, people say, what does that mean? Is it like being a doctor or something like that? So what I'm going to do today is to explain the difference between what medicine is and what public health is, to give you an idea of the importance of public health in your society. So when we think about this bachelor's degree, it's in public health, but we named it Bachelor in Health and Community Studies. So what's the focus? Well, the two big words in there are health and community. And when we think about health and community, we think about the relationship between the health of people and what's going on in the community. So if I were to ask you, what are the major health challenges in Kuwait right now? I think right now, in December 2020, most of us would be thinking about coronavirus, right? But before the coronavirus, I think everyone would also agree, and probably your list would be the same list as my list. What are the most important diseases that create a burden on the health of Kuwait? And we would say cancer, diabetes, obesity, heart disease, traffic injuries, environmental health, and occupational hazards. So these are the things, these are the entities in Kuwait that are creating a burden on the health of the people. So what can we do to solve these problems? So let's start with the example of diabetes. Okay. How many of you know a person in your extended family or a friend or a friend's family who has diabetes? I think if you live in Kuwait, it's probably almost all of you know someone who has diabetes. So when we think of diabetes, most people, they think of the complications of diabetes. You have to take a shot every day. You have heart attacks are increased, or they have to have foot problems or diabetic eye problems. So those are the things that people think about when they think about diabetes, the complications of diabetes. Now, and we think of them going to the clinic and going to the hospital, okay? But I have heard in Diwaniyas, we need more hospitals and better doctors to take care of all the diabetes in Kuwait. Have you heard that? I think many people have heard that. But public health thinks of diabetes in a different way. It's different. It asks the question, where do these people come from anyway? They don't live in the hospital. They don't live in the clinic, do they? No. They come from the community. They're emerging from the community. So public health asks the question, well, if they're coming from the community, is it possible that what's happening in the community is what is causing all the diabetes in Kuwait? Okay? What do you think? Well, we think about children like this. Okay? Now, these boys are obese. Are they sick? No. They don't have diabetes. They don't have any diseases, but they're obese. So we don't blame them for being obese. We don't say, you're a bad boy, you are so fat. No, but public health says why. Why? You know, when I first came here to Kuwait 20 years ago, I didn't see many children like this. You go to the mall, but now you go to 360 and you see, I went there and there was this boy running away from his brother like this. And everyone was laughing. And it was kind of funny. But what's the problem with that? The problem is this, that la samhallah, what's going to happen to him in 10 years or 15 years or 20 years? At that point, do you think he'll have diabetes? Yes. So, and he's going to be one of these boys who goes into the hospital and clinic 15 years from now. So what we want to do is to stop, reduce the rate of people becoming diabetic. So, can I convince you that better hospitals and better doctors don't do that? They don't reduce the rate of people becoming diabetic in the first place. So public health is different from medicine. And I'm not saying that we don't need good doctors in hospitals. Obviously, we need good doctors in hospitals. But public health doesn't focus on the treatment. It focuses on prevention, okay? So I hope I've convinced you that more and better hospitals don't stop the flow of people before they become diseased to reduce their risk of becoming diseased. So the difference here is doctors and nurses and pharmacists and lab technicians focus up here in the clinics and hospitals, okay? Public health primarily focuses down here on the community and doing things in the community. Now, there is part of public health that reaches over to the hospitals. We're not saying they're completely separate. There are things like health policy and management, health services management. Parts of public health do meet with medicine. But the primary focus, the main focus is on the community. So what our goal is to take these big arrows and make them smaller, right? We want to reduce the rate of people moving from the community and having to go to the clinic. What do we want to do? We want to keep people. So we're not treating disease, but we're preventing it. Now, how many of you have heard the proverb, al-waqaya khayrun min al-ilaj, right? Now, if you want to talk about public health and what are you going to be or what are you going to do, you can just use this proverb and this example of diabetes. What public health is trying to do is saying prevention is better than cure, okay? Now, to do that, we have to focus on the community and we need people in the workforce to develop a public health workforce in Kuwait and strengthen this workforce with the skills that are needed to do that. I think you might agree with me that most of the time people are thinking about health and disease just from the hospital side. And would you agree with me that Kuwait needs to strengthen its focus on prevention? That's what this bachelor's degree is all about. And so we need to be able to assess and measure the disease in the population, finding the people before they become ill, okay? Public health program planning, like developing public health programs to reduce the risk factors for disease, healthcare management, communication and advocacy, policy making, community interventions. There are many things that public health is focusing on. Now, there's a term called the determinants of health, which are all those things in the community that are causing the disease to happen. So let's think about those boys. Why is it that now there's more obese 5-year-olds than there was 20 years ago? So public health is going to ask that question, right? So we want to find out why. Is it because before they were outside playing and running around and riding bicycles, and now they're sitting on the Xbox? So what can we do about that? Or is it that, a child who's thin and the mother or the grandmother say, you're too thin. You need to eat more much booze, right? But they're a normal weight. And then you have a nice plump 5-year-old and they say, mashallah, mashallah, right? So maybe that's part of it too. We're not saying that people are bad. We're just saying we need to educate people about what a healthy weight is for the children. And that may make a difference. So public health is looking for those things in the community that are causing the disease to happen in the first place. Okay? Now, the goals of public health, you can think of 3 Ps. Promoting the health of people, so making them more healthy. Okay? Another is preventing disease, disability, and premature death, people dying early. Do you think many children in Kuwait die from measles? No, none are dying from measles. When I was in Kenya, I saw lots of children dying from measles, so there was a premature death. So how did that happen? It was through public health efforts, like vaccination and increased economic situations. And people are living longer, right? 50 years ago, 60 years ago in Kuwait, the average life expectancy was maybe 50 years. And now it's 78 years. You mean people are living 28 years longer now than they used to? How did that happen? It didn't happen just because of the hospitals and doctors. It happened because of public health. Okay? So, and then the third P is to protect people and keep them safe. Okay? Now, that's different from medicine, do you see? So the goal of medicine is to treat people who already got diseases. Public health focuses on protecting the people, preventing the disease, and promoting the health, making people healthier. They can live longer and healthier lives. So now let me turn to the bachelor's degree. This bachelor's degree is 4 years. Although we are in the Health Sciences Center, we are a faculty in the Health Sciences Center, but it's a 4-year program, not a 7-year program. And in years 1 through 3, there are common courses, general public health courses, and then in year 4, we are developing 4 majors, 4 concentrations for the degree. There's public health practice, healthcare management, health research, and community health development. Right now we only have 1, but as we're growing, we have not yet, now we're in our 4th year, I should say. As we grow, we'll add more concentrations. What about the topics you'll study? Well, there are many. Public health is very broad, so you'll be learning about environmental and occupational health, social and behavioral sciences, health policy and management, and health administration, also the biological basis of disease, communication and presentation skills, ethics, social marketing, problem solving. It's a very broad-based degree which gives you many skills that are useful in the workforce. And then you ask, well, what will I be doing after graduation? Okay, so remember, medicine, you can kind of imagine them doing the same thing every day. Same thing, same thing. You know, the dentist is looking in the mouth every day, so they're just repeating the same thing. Public health, on the other hand, is very broad. There are many different things you can do. So you can be doing healthcare management in a clinic or in a hospital, or population health interventions. So developing programs, developing public health policies, and then public health project planning and implementation of the projects and the programs in the community, promoting and protecting health and protecting the environment, very important. And then public health data collection and analysis, So doing the epidemiology, the biostatistics, and doing the assessment of the health of the community. So many different things. But remember, the focus of all of it is to improve the health in the community. Where could you work with this degree? Again, the setting of the graduates from our program will be in many different places. The primary one, of course, is the Ministry of Health. So they have public health services. There's a Department of Public Health, but you could also be in many other departments in the Ministry of Health. So there was a needs assessment done before this faculty was started, or before the bachelor's was started, and the Ministry of Health alone said we need 400 graduates in the next several years, and this was in a Siyasa newspaper there. So there is a need, and guess what? This was before coronavirus, and now the Ministry of Health is even more wanting these graduates. But there are other places you can work. You can work in social services, you can work in environmental health, you can work, say, occupational health services at, say, KOC, hospital departments, schools, disease surveillance programs where they're monitoring the disease in the community, health insurance industry, so many different places where people can work. And what about further training? See, public health, the bachelor's degree in public health is a basic degree, but there are many, many master's degrees which brings you into a professional level of public health. So the main one is Master of Public Health, and you can have a concentration in environmental and occupational health, health policy and management, epidemiology and biostatistics, health promotion, many different types of Masters of Public Health. And there are other Master of Science degrees, disaster management, infection control, health promotion, also Masters of Science in epidemiology or biostatistics. So there are many master's degrees that you can go to. And then beyond that, you can go on to even higher, which is the PhD. And there are many different PhD programs in public health focused on specific areas of public health. Remember, public health is very broad, so it's not just one thing. It's many different areas where you can become an expert in. Now, do you think there are many people in Kuwait with master's and PhD degrees in public health? No. So do you think, therefore, that there is a big need for these people in Kuwait? Yes. That is why the Amir decreed that this Faculty of Public Health would be started. And now we've started. We are now in year 4, and this year, inshallah, we'll be graduating our first class. So now, what about the career pathways? We are working with the Ministry of Health to produce a Civil Service Commission cadre. Now, that has been a challenge, and it's been delayed because of COVID-19. Everything stopped, and so we're starting up again because the main rush of COVID-19, the Ministry of Health wasn't ready, or they were too busy managing that to continue with it. So the cadre will have four categories matching our 4 concentrations. The name of the cadre may be, and this is not finalized yet because we're still working with it, would be Mumaras Sahal Amma Mubtada Thani, going all the way up to Ikhtisasi Sahal Amma, maybe. So that's an idea of what we're looking for in terms of the cadre. We will continue to work hard to have that established, but as of December 2020 right now, it's not there yet. So then you can rise through that cadre either through experience or through the master's and PhD programs. So thank you for your attention. I hope that this has given you some idea of what public health is and what it's not, and how it differentiates from the more commonly understood careers like medicine and dentistry and pharmacy and allied health. Those are the 4 other faculties at the Health Sciences Center. We are now the 5th, and I thank you for your attention. We hope to see you in our faculty.